My name's Shabana Begum, and I am the South Asian Officer for the Hepatitis C Trust.
My name is Imam Yunus Dudwala. I'm the Head of Chaplaincy and Bereavement Services at Barts Health NHS Trust.
I'm Professor Graham Foster, and I'm the Professor of Hepatology here at Queen Mary's in the East End of London. Viral hepatitis is caused by two big viruses, hepatitis B and hepatitis C. These are viruses that travel in the blood and in bodily fluids, and once they get into the body, they go to the liver. Now, the liver is one of the most important organs that we have. If I take your liver away, you will die within 24 hours.
There are different types of hepatitis: A, B, C, D and E. A doesn't turn into B and B doesn't turn into C. They are all different. This film looks at hepatitis B and C. They are two completely different viruses and, if left untreated, can be very harmful for your liver.
As Muslims, we are required to seek knowledge and appropriate means to look after our health. The Prophet Muhammad sallallahu alaihi wasallam, he said, "Talabul ilmi faridatun ala kulli Muslim," that to seek knowledge is necessary for every single Muslim. So knowledge to look after your body, knowledge to look after your cells, knowledge to look after your health is extremely important within Islam.
Chronic viral hepatitis is nowadays controllable. For hepatitis B, we have a very good vaccine that stops people getting infected, and if you have chronic hepatitis B, we have wonderful drugs that will control it and stop your liver getting damaged. For chronic hepatitis C, we have drugs that will cure the virus, and the sort of treatments that I have available today will cure nearly 8 out of 10 people who are infected with hepatitis C. So hepatitis B is controllable, hepatitis C is curable. Our job now is to find people whilst their livers are still working well and get rid of these viruses before they do permanent damage.
Hepatitis B and hepatitis C are often shortened and known as Hep B and Hep C. Hepatitis B is also known as Yirkan, which means yellowing of the skin, and in English it's jaundice. Hepatitis C is known as Kala Yirkan, which means blackening of the skin. Jaundice is totally different from hepatitis B and C, but it can develop in certain people at the later stages of hepatitis B and C.
Chronic viral hepatitis is actually quite difficult to catch. So you can't catch it by sharing people's plates, sharing people's cups. You can't catch it by casual contact. It's not transmitted in the air, and it's not transmitted in drinking water. It's transmitted in bodily fluids, so it's blood-to-blood contact. We know that in many parts of the developing world, the way doctors clean their equipment isn't good enough to kill these viruses. For hepatitis B, we know that mothers who are infected have a very high chance of infecting their babies. For hepatitis C, that's a much lower risk. The other ways that these viruses pass around are a little bit rarer. We know that partners can sometimes infect each other, so wives can infect husbands and husbands can infect wives. That's relatively common for hepatitis B, but not hepatitis C.
Not everybody that comes into contact with the virus gets infected with the virus, but there's no way to know unless you get tested. 20% of the people that catch hepatitis C clear it. This is without any treatment or intervention. This means that their own immune system can cope and they no longer have the virus. Rates vary for hepatitis B depending on when the person catches it. If they have caught it as a child, only 10% clear it. If the virus is severe, your immune system cannot cope. You require treatment. If left untreated, the virus can develop into liver cirrhosis and liver cancer. These cases are called chronic.
The problem with chronic viral hepatitis is that these are stealth viruses. They get into the liver and they sit there for many, many years. So you can be a man or a woman in your 40s or 50s, perfectly healthy, with 90% of your liver having been destroyed by these viruses. The only way of knowing if you're infected, the only way of knowing how much damage has gone on, is to have the appropriate blood tests.
You may have had the virus from 20 to 30 years without even showing any symptoms at all. That is why it's so important that you get tested.
There are different ways to catch these infections. It can lead to great harm for you and for others if it's passed on. Within our communities, there can be a stigma in dealing with illnesses, and then we tend to leave the illness, and this can be really harmful when there doesn't need to be any harm.
People think it's a dirty disease, or they may have done something wrong to have picked it up. This is not always the case.
We know in parts of Pakistan 25% of the population are infected with hepatitis C. So we've gone out into the villages around Karachi and we find that 1 in 4 people are infected with hepatitis C. And we're sure that this is because of medical needles that aren't properly cleaned. What I'm worried about is that in the UK we have a very large number of people born in Pakistan who've lived here for many years. They don't see themselves at risk of hepatitis because of course they're English, they've lived here for years. But because they were born in Pakistan, because they had their vaccinations in Pakistan, they're at very high risk.
Data of 5,000 people indicate 1 in 20 people born in Pakistan now living here in the UK suffer from chronic viral hepatitis.
In Islam, children commonly have their head shaved on the 7th day. Usually razors are used for this. For circumcision, blades or surgical equipment are used. It is extremely important that we protect our children by not reusing blades or razors in case infected blood is passed on. The infected blood will remain on the equipment even if the blood is dry. The virus can remain alive in dry blood for some days. There is a hadith of the Prophet Muhammad sallallahu alaihi wasallam where the Prophet sallallahu alaihi wasallam said, "At-tuhuru shatrul iman." Cleanliness is half of faith. So cleanliness is encouraged in all things, and especially when we are shaving, we must make sure that our razors, our blades are totally clean, sterilized or brand new.
To help prevent blood-to-blood transfer, we recommend that you do not share toothbrushes in case of bleeding gums. For nose and ear piercings, make sure the equipment being used has not been used by somebody else prior because of blood-to-blood contact.
For circumcision and shaving baby's hair, it is vital that the equipment is new or sterilized.
At the barbers, make sure that the blade being used is a new one and it has not been dipped into water in between clients, especially if there's contaminated blood on the blade. Water will not sterilize it.
For travel, if you are going back to Pakistan or you're going for Hajj and Umrah, make sure you have taken all your vaccinations. It is also important to take your own supply of disposable razors and throw them away after each use. Do not share with others. If you are on insulin, then take your own needles. Do not share with others.
Because viral hepatitis is so common in many parts of the world, it's important that if you do get unwell while you're travelling, you look to get healthcare from a well-established, reputable hospital or doctor. It's a good idea to try and make sure that the equipment that's used is sterile, and don't be shy about asking the doctor, is that really a clean needle or has it been used before?
Think of your visits back home. Have you ever been to the barber? Have you ever had to seek medical or dental treatment? This can be from 5, 10, 15, 20, even 30 years ago. Reason is, symptoms don't show. If any of these things have happened, get tested. If anybody in your family has been diagnosed with hepatitis B or C, get tested. If you've had your head shaved, circumcision done, nose pierced and ears pierced, please get tested.
The National Health Service recommends testing for people born outside the UK, particularly people born in Pakistan, should go to their general practitioner, their family doctor, and ask for a blood test. We take a little bit of blood from the arm, we send it to the laboratory, and the test is very reliable, and people will get a result within a week or 2.
Test results will either show negative, which means you do not have the hepatitis B or C virus, or positive, which means that you may have the virus or you may have had the virus at some point in your life.
If you have hepatitis and your doctor knows you have hepatitis, he or she will tell nobody else. It is strictly confidential, strictly between you and the doctor. And if you do have chronic viral hepatitis, and for people whose livers are being damaged by the viruses, then we would start to think about treatment. And what will happen is that your family doctor would refer you on to a specialist. The specialist would see you in the clinic and talk to you about the treatments that are available.
Please don't delay in getting tested. Sometimes we may feel that there are no symptoms and we feel fine, but there is no harm in being tested. It will give us reassurance. Our health, our bodies are an amana and a trust from Allah subhanahu wa ta'ala. It is a great gift from Allah, and it is our responsibility to look after our health, to look after our bodies, and to protect ourselves.
I've seen too many people die of something that I can fix if I know about it early. So please go and see your doctor. Please get tested.